Antiplatelet agents. First of all, we have ASA, which is acetyl salicylic acid or aspirin. So ASA is classified as salicylate or non-analgesic, non-narcotic analgesic, and antipyretic. Uses of ASA. ASA is used to prevent stroke, myocardial infarction, and TIAs. Contraindications. In which conditions we cannot use ASA? ASA cannot be used if the client has agranulocytosis. Can you recall what is agranulocytosis? It is low levels of WBCs. We cannot use ASA if the client has a blood disorder such as hemophilia. It cannot be used if the client has increased intracranial pressure, intracranial bleed, or if the client has a upper GI bleed. So in all these conditions, the use of ASA is contraindicated. Then we have doses, adult doses. Thromboembolic disorders, the dose would be usually as 81 to 325 milligrams per oral once daily, and for TIA prophylaxis is normally 650 milligrams twice daily, 2 times daily PO. And then for myocardial infarction prophylaxis, it is usually 80 to 325 milligrams per oral once daily. Nursing interventions for ASA. ASA should be given with at least 250 ml of water, and it is not recommended to be given with the milk because milk increases the absorption of the medication. As we know that ASA is enteric coated tablet, so it cannot be crushed, it cannot be chewed, and we need to instruct the client to swallow the medication as a whole because we cannot crush or chew it. ASA may cause toxicity in adults and children. So the symptoms of toxicity in adults can be tinnitus, it can be feeling of fullness in the ears or decreased hearing, while in children it may cause behavioral changes, mental confusion, or lethargy, drowsiness, or hyperventilation. So we need to be careful about all these toxicity symptoms in adults and children when administering ASA. Then we have clopidogrel bisulfate. Clopidogrel is classified as an antiplatelet drug. It prolongs the bleeding time by inhibiting the platelet aggregation, and clopidogrel is used to prevent stroke, myocardial infarction, and also acute coronary syndrome. Contraindications. In which conditions we cannot use clopidogrel? It cannot be used if the client has peptic ulcer disease or client has a hypersensitivity towards clopidogrel, and it is also not recommended if the client has intracranial bleed. And we also need to keep in mind that if the client is scheduled for elective surgery, we need to discontinue clopidogrel at least 5 days prior to the surgery. Then we have doses. The usual recommended dose for clopidogrel is 75 milligrams per oral once daily. But if the client has acute coronary syndrome, which is with the non-ST elevation, then usually 300 milligrams of clopidogrel is given as a loading dose, and then 75 milligram per oral once daily as the maintenance dose. Nursing interventions. When we administer clopidogrel or initiate clopidogrel, we need to instruct the client not to take any over-the-counter acid-reducing meds because they interact with clopidogrel, not to take any non-steroidal anti-inflammatory drugs over the counter. They increase the risk of bleeding if we take them with clopidogrel, and not to take ASA because it will also increase the risk of bleeding. So we should instruct the client if any of these medications are required, the client should consult with the physician. And then while administering clopidogrel, we should be monitoring the platelet levels closely, platelet count, and also lipid profile closely when giving a clopidogrel. Then we have abciximab. This drug is classified as antiplatelet as well, and it prolongs the bleeding time, inhibits the platelet aggregation. This drug is infused during the PTCA and also for the 12 hours after the procedure. Contraindications. In which conditions we cannot use this drug? It cannot be used if the client had a GI bleed in the last 6 weeks, had CVA in the last 2 years, or a recent major surgery or a trauma. And then if the client has severe hypertension. So in all these conditions, abciximab drug is contraindicated. Then we have doses. It is given intravenously. The initial dose is 0.25 milligrams per kilogram. Bolus dose is given prior to PTCA, and this is given over 10 to 60 minutes. And then the maintenance dose is as a continuous infusion is given as it would be 0.125 mcg per kilogram per minute, which is given for the next 12 hours. Then we have nursing interventions. When we are infusing abciximab, we need to monitor the client closely for any symptoms of bleeding. The symptoms of bleeding can be hematuria, blood in urine. Then it can be epistaxis, nose bleeding. It could be melena, blood in stools. And if any of the bleeding symptoms noted, we need to stop the infusion and notify the prescriber for the further directions. And we should also be closely monitoring the client's PTT levels at least every 4 hours during this therapy. And then we should also be avoiding invasive procedures and also any invasive devices to avoid the risk of bleeding. So that's all about antiplatelet drugs. I hope this will be helpful. Thank you.